So what happens when we have a malaligned knee and on top of it we incur an injury to the meniscus again? Hi friends, today we are going to talk about correction of the alignment of the knee joint when we have malaligned knee but a relatively preserved cartilage in most of the knee joint so that we can offload it where it is getting extremely loaded and try and preserve it to some extent and sort of delay the progression or sequelae of osteoarthritic changes. So this friend of ours has unfortunately sustained an injury to the meniscus, which is shock absorbing cartilage, alongside a pre-existing malalignment. The malalignment was leading to excess pressure on the inner side of the knee joint. On top of it, the meniscus got torn. Unfortunately, there were a lot of knocking when she tried to bend her knee beyond a particular degree. That's why we had to go in and clear off here in the meniscus by trimming it and balancing it. And after that, we took pictures of the cartilage, as you can see, which was also a bit worn out in multiple places. But fortunately, the rest of the compartment was absolutely fine and pristine in terms of the cartilage, and hence it was not really a contraindication for correcting the alignment. Since we had already taken detailed consent and explained the procedure, which the patient was already aware of somehow even before coming to us and was keen to go ahead anyways in the long run, we went ahead and did the HTO, that is high tibial osteotomy for this patient, correct the malalignment. We make a cut in the bone, try and correct the alignment, hold it with some plates and screws, put some bone graft in the opened up wedge or the cut open bone, and wait for the bone to heal completely unite before allowing any strenuous activity. However, in general, if everything goes well and the bone quality is very good, then we can allow full weight bearing theoretically after the surgery as soon as possible. But in this particular case, because the bone quality was relatively okay, I decided to go ahead with about 2 to 3 weeks of non-weight bearing and then take it further according to the healing process. However, since we had cleared off the torn meniscus, we also encouraged to do range of motion exercises in bed to avoid any stiffness in the knee. The whole process was done so that we can save the natural cartilage of the bone and preserve the knee joint as much as possible for as long as possible, because eventually the cartilage changes on one side and it is going to progress. But if we can slow the process, we can try and save this relatively young female from getting a very early total knee. Thank you.